Hello, I'm Dr. Patrick McGrath, and I'm the Chief Clinical Officer at NOCD. Happy to have you here today to discuss a few things about treatment. Let's talk about finding an OCD therapist and some important things to really pay attention to when you're doing that. So the first thing is that a lot of people will say that they treat OCD, and you really want to question that and make sure that that's the case, right? Just because somebody's attended a seminar doesn't mean that they treat obsessive compulsive disorder. I don't think if you saw a hand specialist who said, well, I went to a talk for 2 hours about how to do hand surgeries, that you would trust that, right? Treating OCD is really specialized, and it takes a lot of training to really understand it, to know the intricacies of diagnosing it, and to truly understand how to do exposure and response prevention therapy, which is the gold standard of treatment for OCD. So we wanted to go over today a couple of tips for you to just kind of think about when you're looking for a therapist who says that they treat OCD. How can you question them? And how can you make sure that you're standing up for yourself, right? So let's talk just about a couple of things. If you're looking at a therapist profile and their profile lists that they specialize in anxiety, depression, eating disorders, psychosis, children, adolescents, adults, older adults, divorce mediation, and also lists 12 different kinds of therapies that they do, I'm very wary of that person. I don't trust that person as being able to be a specialist in all of those things, right? It gives me pause when I see something like that. And so I would focus on people who really are, as much as possible, honed in on a couple of things, right? If you were to find a profile of me, it would say I do exposure and response prevention therapy for OCD, anxiety disorders, and trauma. Really, that's what I do. And that's what I'm going to advertise myself as doing. And one of the nice things about the work that we do here at NOCD is we train people to be able to do that very thing. That's what we focus on. That's the work that we really do. And this is so important, again, because a lot of people will seek out therapists and people will say, oh, I met with someone who says that they treat OCD. And what do you do? Well, we do a lot of diaphragmatic breathing and muscle relaxation, and they tell me that if I have a thought I don't like, to snap a rubber band on my wrist every time it happens, or if I have a thought or an image or an urge that I don't want to have, I tell myself the opposite thing. Like, so if I have this fear of what if I were to harm my children, I think, no, I love my children every single time. Well, all of those things can really become compulsions, and that's not what we want to see happen. We don't want to see more compulsions in this situation. We want to absolutely see less compulsions going on in this situation. So please feel free to ask any therapist that you're going to meet with a couple of things. Number one, what's your specialization in OCD? How have you been trained in OCD? Who trained you in OCD? How many OCD members have you seen? We call patients members at OCD, so I'm used to saying that. But how many members with OCD have you treated, right? This is important. Do you use exposure and response prevention therapy? Are you willing to work in conjunction with somebody who might be a medication provider? Not everybody who has OCD has to take medication, but some people might be on it already, and they want to know that the person that they're seeing is also going to work with their provider in this situation. You also want to make sure that the person has availability to see you, right? There are specialists out there who might have a 3-month waiting list. And do you want to wait 3 months in order to finally get the therapy that you need, right? So you want to strike while the iron's hot in this situation. If things are really flaring up, it's best to get started on treatment, and hopefully even before things start to flare up, which you really want to start on treatment, because if you're waiting till things flare up, then that might even lead you to needing a higher level of care, like an intensive outpatient, a partial hospital, or even a residential treatment program. So Find a therapist who really specializes in this. Make sure that they can give you answers that are satisfactory to how they specialized and what the work they will do with you is, and make sure that you're comfortable with that person. You've got to have good rapport with any therapist. If you're expected to share with people all sorts of things, some of which might be really taboo in nature, and you don't find yourself comfortable with the person you're talking to, that ought not to be the person that you reveal all of these things to. Then you should really make sure that you are comfortable sharing with this person, because you don't want to waste any time or energy. You want to really get involved in doing this work and getting into it right away, and as deep into it as you possibly can, as not necessarily quickly as possible, but as comfortably as possible. And even comfortably might be a little bit, because OCD will say, oh, I'm never comfortable. But you ought to be nudged consistently to move toward things that are uncomfortable, right? I'll bring up the word comfortable only because I want to say this. The goal of the therapy is to become comfortable with being uncomfortable. And so you want to move toward that level of feeling uncomfortable as much as possible, and learn that whatever those thoughts, those images, or those urges are that pop into your head, you can live with them. You can handle them. You may not like them. It may not be comfortable, but you can live with them. Now, if you're looking for where to find people, there's a few places you can trust. There's the International OCD Foundation. They have a directory on their website. That's iocdf.org. And we at NOCD also specialize in obsessive compulsive disorder diagnosis and treatment. You can check us out at nocd.com. And if you're interested in what we might do at NOCD and how we bring in therapists, well, first, we have a really selective hiring process. We do not hire every person we interview. That just does not happen. You've got to pass through the interview first. We even go through certain vignettes about what OCD is, what OCD treatment looks like, how we might do exposure and response prevention therapy. And we do weed out therapists in that who might find certain subtypes of OCD to be things that they wouldn't be comfortable working on, who don't recognize the ego dystonic or the unwanted nature of the OCD thoughts or images or urges. We make sure that the people coming in are people who want to work on OCD. Then there's a really high level of training that we do. I have been recently meeting with every single one of our therapists, and that takes over 100 hours for me to do. And let me tell you, every single one of them has said to me, I've never been trained so much as I have at this company, right? No one has ever gone through this in-depth level of training for one condition like you guys have. So I'm really proud of the fact that we do an amazingly intensive training for people to help them learn about OCD so that they can then pass that knowledge on to the members that they're working with. You'll get a really thorough evaluation yourself as a member here when you come in for treatment. But know this, before that, we put our therapists through evaluations, right? They have to do mock sessions with us first before they're allowed to go do them live. And they have to demonstrate to us that they can utilize our electronic health record, that they can apply the knowledge that they were trained in to a person that's coming to see us at NOCD, right? If you're going to spend your time and your money with us, you deserve to get a service that you find to be A+. And that's what we want to make sure happens. So we're constantly training and retraining our therapists to assure the highest level quality. There's all sorts of continuous learning. We are a continuing education provider through NOCD, so that allows our therapists to be able to attend CE trainings. We also have at least 15 hours of case consultation going on a week. Many of that is in group format, and a lot of that can also be an individual. I even have the ability to hop into sessions with people also to make sure that we're giving you the best care possible. So that's always fun to do. Just a little 15-minute jump in, check in. If you have any questions, what I can do to help out. But our clinical leadership team can also do that. And we really enjoy the ability to have that hands-on experience, right? So we love to provide those case consultations throughout the week to people. We appreciate when our therapists bring cases to them. We discuss them, and then they can go and they can apply that learning right away in the next session with you. And that's just a mandatory thing for people here at our company, that we want them to keep coming in and doing these case consults, because you can always learn more about OCD and the way OCD presents. And then finally, we're available nationwide. We do teletherapy. We're right there in your home with you. All that's needed is an internet connection. We get more and more relationships going with insurance companies all of the time to try to make it an affordable experience. We even have a payment plan. If you have an insurance that we don't take or you don't have insurance, we have a payment plan that we can even provide to you, hopefully making that treatment as accessible as possible. We would love to help you any way that we possibly can with obsessive compulsive disorder treatment and related conditions, because we also work with body-focused repetitive behaviors like excoriation, which is skin picking, trichotillomania, which is hair pulling. We do work with tics, we do work with hoarding, and our therapists go through training for other anxiety disorders and also for mood issues as well. That way, we want to be the one-stop shop for OCD and related conditions. So we hope that you will test us out, put a trust in us, and see what we can do to provide things for you. If you're matched with a therapist and you just don't feel like it's the right match, we can even assist you finding a different therapist in the state that you're in who's licensed to be able to work with you. We know that sometimes personalities might just not match with each other, and that's okay. We will offer that opportunity to you. So check out again, NOCD.com, InternationalOCDFoundation.org, IOCDF.org, and see if there's a therapist out there who might be able to assist you in the best way possible so that you don't have to have OCD in the driver's seat, right? I want you to live the life that you want to live and not the life that OCD wants you to live. Thanks for watching. If you ever need anything, please don't hesitate to reach out. We also, if you're curious about even, do I want to do this, we offer what we call a NOCD 411 session. The beauty of these sessions is that if you have questions about OCD or related conditions but might not be ready for therapy, or you're a friend or a family member of someone who you think has OCD but you're not sure how to support them, we can even provide that too. So again, check us out at NOCD.com. That's NOCD.com. And we hope to hear from you soon. All the best.